Dear students, let us discuss about the axillary nerve. See the image and give your observations. A patient gave a history of traffic accident and inability to lift and rotate his left arm. Explain the anatomical basis. So, concentrate on the picture and find out what are the differences between the right and left sides in the shoulder region. At the end of the class, you will be in a position to give explanation for this image. Look at the picture. You are seeing the humerus and the scapula, their articulation, and you can follow the posterior cord of the brachial plexus. So the posterior cord is formed by the posterior divisions. So its root value for the posterior cord will include all the contributions for the brachial plexus. So that is C5, C6, C7, C8 and T1. And there are 5 branches from the posterior cord of brachial plexus. They are upper and lower subscapular, thoracodorsal, axillary and radial nerves. So we are discussing about the axillary nerve. It is also called the circumflex nerve. And what is its origin? So it is arising from the posterior cord of the brachial plexus as one of its terminal branches. It is taking origin from the posterior cord of the brachial plexus, and its root value is C5 and C6. In this picture, you can see its muscular branches to the deltoid and teres minor muscles and the lateral brachial cutaneous nerve. See the relations of third part of axillary artery in this picture. And now let us focus on the course and relations of the axillary nerve. So the axillary nerve is beginning in the axilla and its relations in the axilla are medially the radial nerve. You can see the relation with the radial nerve medially, and anterior to it is the axillary artery, and posterior to the axillary nerve you are seeing the subscapularis muscle, and in the axilla it gives an articular branch to the shoulder joint. So in this picture you are seeing the axillary artery vein and the relation of the axillary nerve with the structures in the third part of axillary artery. So they are radial nerve medially, axillary artery anteriorly and subscapularis muscle posteriorly. And after passing through the axilla, it exits the axilla at a turning point. So where is the turning point? It is at the lower border of subscapularis muscle. It will turn backwards. In this picture you can see it turning backwards at the lower border of the subscapularis muscle to enter the quadrangular space. It is accompanied by posterior circumflex humeral vessels. Now in this picture you are seeing it in the quadrangular space. So in the quadrangular space, it is closely related to the inferior aspect of the shoulder joint, and it is closely related to the medial surface of surgical neck of humerus, which is forming the lateral boundary for the quadrangular space, whereas the medial boundary is by the long head of triceps muscle, which you are seeing in this picture, and below by the teres major, and above you are seeing the teres minor muscle. So it is passing through the quadrangular space. In the quadrangular space, at the level of surgical neck of humerus, the axillary nerve divides into anterior and posterior divisions, which you are seeing in this picture. It is dividing into anterior and posterior divisions at the level of surgical neck of humerus. And coming to the anterior division. So look at the axillary nerve, its anterior branch and posterior branch. The anterior branch, if you follow, it is winding round the surgical neck of humerus under cover of deltoid muscle, and it supplies the deltoid muscle and the skin over the lower part of the muscle. That's about the anterior division. Coming to the posterior division, it gives muscular branches to the deltoid and teres minor. Then it emerges from the posterior border of deltoid to become the upper lateral cutaneous nerve of arm. And the branch to the teres minor coming from the posterior division, it ends in pseudoganglion, which you can observe in this picture. So let us summarize the branches of the axillary nerve. In this picture, you can see the formation from C5 and C6 roots, and then a branch to the shoulder joint you are seeing, and once it entered into the axilla, you are seeing its division into anterior and posterior branches, which will be at the level of surgical neck of humerus in the quadrangular space. The anterior branch giving motor supply to the deltoid and a cutaneous branch to the skin over deltoid. The posterior branch also giving a branch to the deltoid and teres minor, and then becoming the upper lateral cutaneous nerve of the arm. So the muscular branches are to the deltoid and teres minor, and it will give vascular branches to the posterior circumflex humeral artery, the articular branches to the shoulder joint. The cutaneous branch is the upper lateral cutaneous nerve of arm. In this dissection, you can see this is the subscapularis muscle, and you can see the division of the axillary nerve into anterior division and posterior division, and you can see the distribution of the anterior division to the deltoid muscle, and then see the distribution of the deltoid muscle by the posterior division and the branch to the teres minor, which shows a pseudoganglion. The axillary nerve obeys Hilton's law, which says a nerve passing over a joint supplies the joint, and the muscles acting on the joint the skin over the joint. The axillary nerve is motor to the deltoid and teres minor muscles that are acting on the shoulder joint, and it also supplies the shoulder joint, and there is a sensory innervation over the deltoid and upper posterior aspect of arm by the axillary nerve. Clinical importance of axillary nerve. Now coming to the image which you have seen at the beginning of the discussion. So if you observe both the shoulders, observe the right one is having a normal shoulder contour is there, whereas on the left side there is loss of shoulder contour with greater tubercle becoming prominent and wasting of the deltoid muscle we are seeing, and the person complained inability to abduct and lateral rotate his arm. So loss of shoulder abduction and external rotation of arm is there. So that is due to paralysis of deltoid and teres minor muscles. And there will be weak lateral rotation of arm because of paralysis of teres minor. So there is atrophy of the deltoid muscle because of the injury to the axillary nerve, which is close to the surgical neck of humerus. Fracture surgical neck of humerus can occur in case of traffic accidents, and inferior dislocation of head of humerus also can cause this type of symptoms. So because of the injury which can be due to inferior dislocation of head of humerus or fracture surgical neck of humerus, which results in motor loss because of paralysis of deltoid and teres minor muscles, which is responsible for wasting of the deltoid and loss of shoulder contour and loss of shoulder abduction and external rotation. The sensory loss that can result from injury or loss of sensation over the lower lateral part of deltoid, which you can see in this picture shown with the green color. So it is seen as a regimental badge pattern of anesthesia because of involvement of upper lateral cutaneous nerve of arm. Hope you have understood the axillary nerve, its course and relations, and its clinical importance.